So I think we're going to start the final session of this afternoon. So I ask if you can take your seat. There'll be two components to this final session. One is a very unique experience. We are very grateful to have a patient, Janet Wright, with us. She had polycystic kidney disease. She was here last year, and she shared her journey through polycystic kidney disease. And this year, she had gained some additional perspective that we are all delighted to hear about. And then also my colleague, Dr. Gavril Hercz, who's a nephro psychoanalyst, nephrology training and psychoanalytic training, and he's going to facilitate the interview of Janet to lead us through her journey. And then after that, we have an open forum, and we're going to take some of the questions. And also, last year, there was a specific request that we kind of discussed about the essential components of starting a PKD clinic. So we will do that first, and then we will take up all the questions. There are a number of questions that we have not covered in the talks. We will probably discuss in the open forum as well. So without any delay, can I ask Janet and Gavril to come? And thank you very much for coming.
So, can everybody hear? Okay. So, I'd like to thank Janet for coming back again. I feel like this is a conversation that we started last year, almost at the exact same time. I don't know how many of you were here. And we started a conversation really about what this lifelong journey has been for you. And I think you maybe corrected me and said, not necessarily a journey, but a rocky road with stops along the way and maybe sometimes even cliffs or walls along the way. Mm-hmm. And before we get to today's news, I wonder if, or maybe we can start with today's news and maybe tell us what's been happening over the last few weeks.
Well, I'm 10 days with a new kidney. I had the transplant on August the 26th. I was home in 4 days post-op, and I cannot tell you how well I feel. It is beyond words. I'm so grateful for my live donor. Yeah, it's been a very profound journey, and hopefully with communication and awareness, a lot of other people with chronic kidney disease will benefit from support, because it's a journey that is very difficult to do on your own.
Just in terms of even this, the recent event of having a transplant, I would think that when we're on the clinical side, when we're in the hospital, in the transplant clinic, or as nurses or doctors, we look on it as, okay, we have to get you tested, we're going to find your kidney, and then once you have your kidney, you're good to go. But I think that in a way, this must have been a more complicated road from your perspective than what these words describe. And I wonder if you can sort of bring that to life a little bit.
Well, when you have the chronic disease and you're just going day by day and you're saying, okay, well, I'm 40%, I'm 30%. But when you get that phone call and say, well, you know what? You've hit that wall or cliff, and you now are moving from your nephrologist who's taking wonderful care of you and then going into the kidney care transplant unit. It's like you're leaving all of your friends and your support and your trust behind you. And it's a very lonely feeling. And the clinical information was excellent. The processes, I'll talk about that in a minute. it was all different mini steps within that transition of going from Dr. Pay into the clinic. The toughest part was just feeling so vulnerable, trying to understand the system, having the system manage which donor is going to be brought forward, and they only test one donor at a time. My brother was declined, and then a few months later, a friend was starting to be tested, and then she was declined, and then a few months later. So that journey of waiting for that life-altering transplant, someone's kidney, was, I think, the toughest thing that I've ever endured in my life. A couple years ago, sadly, my nephew had committed suicide, and I thought I understood his level of despair. And I had no clue until I hit that moment of despair. There was a week where I honestly understood why someone would take their life, because I was so low. And that was just after my second transplant donor was declined. And I figured I'm resilient and I'm tough. And I did not reach out for help. I should have. But I'm sure there's a lot of other people who experience that. I don't know how people on dialysis, fortunately, God bless, I did not have to go on dialysis. I don't know how they live day to day and week to week, trying to manage their homes, their families, their relationships. It is truly an all-consuming, emotional wave that carries you through these points.
I mean, you've raised a few points that I wanted to maybe get into a little bit more detail, because I'm not sure we have much chance in the hospital environment to talk about these things. And I think one of them was, you mentioned how you were with Dr. Pay for quite a few years, and you have a profound relationship with him. But as you say, once you move into a transplant, they move you over to a totally new clinic.
Yes.
And maybe you can talk a little bit about what does that mean for you? I mean, we can look at it from the hospital side and say, well, that's the way we do things, and it's an efficient way of doing things, but I wonder how that has affected you, or how that made you feel.
I felt more vulnerable. When I was with Dr. Pay, I was taking generic. I felt taken care of. I felt that this pill was keeping me afloat with my kidney disease. And then when I moved from Dr. Pay to the transplant clinic, or to the kidney care clinic, I was taken off the drug. And it was like, oh my God, what's going to keep me alive? And it was just, well, stop taking your pills, it's clinical. You're moving on because you're going down transplant. And it was like everybody was great with the other clinic, but I didn't know them, and there was a very large team, and they managed so many patients, and they give you this a Class A book with what to expect, but it's all clinical. It doesn't talk about feeling afraid. It doesn't talk about where's the phone number that you could just sort of pick up and call and say, I'm scared out of my boots, or I'm so low, I don't know what to do. My family has been unbelievably supportive, but as a mom and a wife, I'm not going to impose my emotions on my children and family. I don't want them to hurt and be hurt because of me being hurt. So it's a natural instinct to protect the ones you love, but then that isolates you. It isolates you from your friends, it isolates you from your family, and it's not addressed when you move into that clinic mode. Like no one ever said, well, how are you feeling? What does all this mean to you? It was like, okay, blood work, appointments, et cetera, and that's all good, it's necessary, but there's definitely a piece missing, I think.
So I wonder if what you're speaking about is really that we as clinicians focus on things that we can measure,
Absolutely.
right? So we look at the blood test, it's something we can talk about, something we can manage and change. And I wonder if what you're talking about is something that's incredibly emotionally impactful, but not really recognized. And I think one of those things is, I think, the transitions. So for example,
Yes.
if somebody goes from a pediatric hospital dialysis unit to an adult dialysis unit, and they leave that behind, or if somebody goes from the kidney clinic into the in-center and starts dialysis, that those transitions are the points of greatest anxiety and depression.
I totally agree with you based on my personal experience. Like every transition, even going from my nephrologist who followed me for 25 some odd years, moving from him to Dr. Pay was again a transition. And it's learning, everybody speaks the language, but how you communicate and translate those words when you move from one group of physicians to another, it's different. And it was so difficult because I get the call and beautiful Crystal says, "Okay, Janet, it's time," and it was sort of like, I'm not ready. I knew it was going to happen. I've had polycystic kidney disease for over 30 years, and I knew I'd have to have a transplant when I was in my 60s, but I'm not ready. And they just assume you are. And something else has to be integrated into that process, through the transitions, and even something once you've passed into the new clinic, to have someone either check in on you or I don't know what the solution is, because I honestly don't understand the full healthcare system in some areas. But
Yeah, I mean, we talked about some of these things, that the fragmentation. So, for example, where you might go to one clinic for one organ and another clinic for another organ, and how fragmentary that may seem. The other point that you brought up that was the fact that there were several people who were willing to donate, and then they were rejected.
it was for them like a living death. My brother was devastated because he kept on saying, "Janet, I've got those turbo kidneys and I'm going to keep you alive and I'm there for you." And when he got the call, it was awful. And there wasn't any support for him. Like donors, oh yeah, the donors, they just give a kidney and off they go. Well, you know what? They're the most important component in all this. They have to be healthy. They have to, they need emotional support. It was devastating for him. And then when my girlfriend, when her kidney was not compatible with me, and she phoned and we had a cry on the phone, and 3 weeks later she phoned Janet. She said, "I'm depressed. I don't know what to do." She said, "I have to see you. We have to talk." So we went out and we had a couple glasses of wine and some cheese and crackers, and and we talked. And I'm not a therapist. I don't know how to support people who are grieving because of how they feel, because it was their loss of me. And she kept on saying, "Janet, I can't live without you. And now I can't help you." And then she just gets one phone call. "Sorry, not compatible for these reasons," and boom. Absolutely no follow-up call to see how she's doing psychologically or emotionally. None whatsoever, and not with the recipient either. There was no follow-up on that whatsoever.
I think in a way what that brings to light, for me at least, is that we can spend a lot of time looking at these cysts in these kidneys and how they impact and affect the kidney function. But I wonder if to some extent we miss the bigger picture in terms of the impact of what those kidneys do to the people who are dealing and navigating life with those kidneys that are enlarging. I think that's one part. And the other part is what it does to the external relationships in terms of you living with this illness and how it impacts these relationships that are outside. And I don't don't know, maybe you can tell us a little bit about that.
That's a complicated one. Whenever I see anybody, they say, "My God, you look good." And I'm thinking, are you friggin' kidding me? You know, I feel like crap. I'm sleeping 16 hours a day. I get up at 10 or 11 o'clock. I do one thing a day, and that's my life. And my husband would watch the slow deterioration of this disease. And, you know, it's a bad movie he can't turn off. And, you know, he's supportive as much as he can, but there's nothing that he can do to change it. And I would, at first I thought people were withdrawing from me, but that was not the case. I was withdrawing from them. I had to really stop and think and be honest with myself. And part of it, the reason was, how do you explain to someone that you are in chronic fog with no ability or energy to function? You know, so like that one day, like if I met someone for lunch, then that would be it for the day. But they would say, "Janet, you look great." Of course I'm going to go out and try and put my makeup on and do my hair and look great. I'm not going to go out and just kind of, you know, sit there, "Oh God, I feel badly." You know, you want to be upbeat and positive because, you know what, everybody else has an awful lot of things going on in their lives. However, it's really difficult to articulate that feeling and the loneliness, the depression, and at that one point, that moment of despair. It was life-altering for me. Does that answer your question?
Yeah. And I guess in a way, maybe that's the highlight for me, is that, you know, one travels a lonely road.
Oh, hugely. Hugely.
And did you have a chance along the way to connect with other people with PKD or on a similar road?
I signed up with the Kidney Foundation to do volunteer work on the phone calls. So when people call in, and what they do is they have a triage, and so you do a training and what have. So I met people in that workshop, and it was interesting to hear their stories, but only a few in that room talked about how they felt emotionally. A lot of them were talking about, you know, what type of dialysis they were on, and, you know, how long had you had your kidney. But there was only like 2 people in that room that actually said, you know, this is really hard on my family, and this is really, really hard on my wife. And you know, it was more of a knowledge fair versus a support conversation. And I have 2 cousins that have it, and they look at Janet and, okay, well, let's see what happens with Janet, you know. And they're 10, 20 years behind me where I am right now. And, you know, but I sometimes blame myself for not looking at hotlines and phoning, but, you know, they're not in your face. They're not in there. It's not as if when you see your doctor, you say, you know what, here's a card, or, you know, there isn't a proactive mechanism for someone who is going through this process. And I think that is definitely needed. And just a little story, and it's not about kidneys, but my roommate at Toronto General, she had a double transplant, heart transplant. And she said to me, she said, you know what? She said, I'm afraid to get out of the bed because I don't know if I can breathe. And she stayed mobilized in her bed for a few days because she did not have the information to say, get up and get moving. You know, so, you know, I think it's widely spread across the medical system, in my opinion, the lack of information.
Well, and I guess support or understanding in terms of it different phases what somebody may be going through. I guess even something, as you say, like a transplant, where somebody would say, well, all you need is a new kidney and you'll be as good as new. And yet I get a sense that it's a much more profound process, even the timing before you get the transplant.
You're on a treadmill and you're in other people's hands as you go along. And then when you get to that transplant mode, and when you come out the other end, it is the most profound feeling of you're just overwhelmed, because you sit and you reflect. Like my first night home, I was holding my kidney, and if my girlfriend didn't give me this kidney, you know, it's dialysis or something not so good, you know, and how do you process that gratitude and the gift of life from somebody, and how do you carry it forward? And like, you know, there's some days like I would have a little cry of gratitude, you know, and it's not that I'm depressed. I just have this overwhelming feeling, and what do you do with it? You know, you kind of, like here, it comes up here and you sort of push it down because you don't know where to put it or take it.
I think you told me you even had a name for the new kidney.
Oh, my kidney's name is Bella. So Bella is big and beautiful and boastful. And the other component of the name is part of the bell, because our respective husbands were teased that when Jane and I got home from the hospital, we would be princesses with our bells in our rooms, or our husbands would come and serve us. So that's how my kidney became named Bella.
In a way, you know, the kidney becomes, you know, almost like a person, or it has some attributes beyond being a physical organ. And I wonder whether you've, even before you had this kidney or since, any sort of fantasies about how this kidney is changing you, or what it brought to you, or?
I look at it as an external component to my body and my soul. I look at it as a new component that will keep me alive and healthy. And it's kind of surreal, you know, it's sort of, it's there, it's part of my life now, but it is an external unit, and there is fear of rejection, and one can't think about that, so that's another element. You know, you can't think about it not working, you just have to continue feeling positive and do what you're told and pray that it all works out.
So it's an interesting point. You talk about the surrealness of it, and do you think the surrealness, is there a component of that in a way this kidney is you and not you at the same time?
That the kidney is me and not me at the same time.
Well, you know,
I heard you saying, yeah. Right now, I think I'm maybe blending into that, because right now, like, this is like day 10. Mm-hmm. To me, it's still an external component, and it's almost as if I'm pregnant. I'm going to be pregnant forever, and I'm carrying this baby. And this baby's going to be so well taken care of, and that's kind of how I look at it.
Yeah, I mean, it's interesting, because in a way, you know, pregnancy is like that. It's you and not you.
Yes.
But it's a new reality, and it's a new relationship. And I guess it also kind of makes me wonder whether living with the native polycystic kidneys is a similar relationship, where these kidneys these kidneys are you and not you. They're you, but they're also kidneys that are dramatically changing your life. They have, their own say. I don't know if that has any meaning.
I understand what you're saying. Yeah, because when you're diagnosed with polycystic kidney, it's almost as if you have a kidney and then you have a polycystic kidney. Like you identify with a healthy kidney. And even though you have polycystic kidney, and in my situation it's genetic, it just, I don't know, it's there, but it isn't there.
Well, and I think
if that makes sense.
Well, I think it makes sense, but also I think in a way it transforms your life. So I think most people in the room here are not thinking about their kidneys on a daily basis. They just take them for granted.
Oh, you think about it every day. Yeah. Holy doodle, yeah. A day doesn't, when you have the disease, and especially when your blood work and all this, stuff that comes back is decreasing, it becomes a focal point, and you almost become somewhat paranoid, like, I'm having too much potassium, too much salt, too much this, too much that, and yeah.
Changes your destiny.
Oh, it totally does, and you have no control over it. And that's the hard part, because you're sitting back, and I think I mentioned this last year, you're watching a bad movie and you can't turn it off. And that movie just gets worse and worse and worse and worse. And, I think, though, for the physicians, I think it's important for them to identify that, this organ is getting bigger and this person's body image is changing, their energy level is changing, their mood, like in terms of depression or feeling lethargic. All of those things affect the whole being.
So
it affects the whole being. It affects how you think and how you approach things, and it affects your digestive system if you're nervous, and it's not just the organ.
No, I think you're making a very important point, because I think sometimes we get lost in looking at it as just an organ malfunction and the impact biochemically of what an organ malfunction may mean. But I think what you're saying is that it has ramifications way beyond that. It affects every day and every part of your daily life.
Absolutely. Yeah. No, every day you wake up and your first thing you see is your big belly. Oh, great, And then as you get older, you really don't care about that much. But it's it just doesn't leave you. And so I talk to people and they say, oh, that's great, you've got a kidney, way to go. And I said, yeah, but I still have the disease. I still have 2 kidneys in my body that are growing and getting bigger. And I still have polycystic liver disease. And my liver will continue to get bigger. So I still have this disease. And it doesn't register with most people. They forget that it is a disease. And they think once you get that kidney, you are cured. No, it is life support. It is absolutely, fundamentally, flat out life support. And that's what I say to people. And some get it and some don't.
Well, I wonder what are some of those things that we hear sometimes which may not seem so empathetic, which is, well, now you have a kidney, you have a new kidney, you have a new life. Mm-hmm. Maybe things that we say, and by that I include ourselves as doctors, nurses, your peer group, your friends. Maybe it's a way of protecting ourselves from working with people with these illnesses, and sometimes it may be hard for us in terms of day in, day out, traveling a road with patients who are coping with these illnesses, and it may be our own way of providing some defense or some support for ourselves to be able to go on. But what I hear you saying is that sometimes it comes across as really not a very empathetic statement. But I think it's, as you say, this impacts all kinds of relationships, and I think it may be impacting clinicians as well as patients and their families. The other thing is, I don't want, before our time is up, I didn't want the time to end before we also comment on the area that although this illness, and as any illness, can have a huge impact on our emotional state and our relationships, that in a way it does bring some positives as well in terms of building, maybe you want to speak a little bit towards in terms of building resiliency and strength and what that has meant for you.
For me personally, it was more protecting the people and relationships and my loved ones and my family, and being resilient and not bringing it forward, whether that's positive or negative, I don't know. With friendships and extended family, it has impacted relationships through the journey, and because I withdrew. But now that I've had the transplant, it's like the lemmings are coming out from underneath the carpet. Like all my friends are, oh my God, Janet, this is great. But I think they themselves didn't know what to do, but I didn't know. See, that is something that could help someone in this journey, is for them to be, like, how do you talk to, someone and help them understand how you feel, and not being doom and gloom either, right? But just help them to understand and say, well, what do you need? Like one friend asked, what do you need? And I said, I just need someone to give me a hug. That's what I need. You can't say that to everybody.
Well, I guess in a way you've arrived at your new normal, as you call it. But anyway, I'd like to thank you for your new road and for sharing with us with all your strength and resiliency. Thank you very much.
It's my pleasure.
Yeah.